Assalamu alaikum. Now I would like to discuss about how to deal with the mixed primary acid base disorder. These are the mixed primary acid base disorder. So for dealing with mixed acid base disorder that involves two or more than two primary disturbance and may be suggested by either a very abnormal pH like pH is less than 7.2 or pH is more than 7.6. In this system pH is less than 7.2, 7.08, very low pH, and pH is more than 7.6, or a near normal pH despite significant abnormalities in the serum bicarbonate and PaCO2. So look at the pH first. If pH is less than 7.2 or more than 7.6, think about dual pathology, think about mixed disorder, or normal pH but abnormalities in the serum bicarbonate and PaCO2. Acid base status is evaluated in a acid base status is evaluated uh, in stepwise fashion. Evaluate evaluate pH. Evaluate the pH. Normal is 7.4. Evaluate assess pH. Determine the patient's overall acid base status on the AVG test. Acidemia is if pH is less than 7.35 and alkalemia if pH is more than 7.45. Then determine the primary disorder. Analyze the metabolic component serum bicarbonate, which is normal is 24, and the respiratory component normal is 40. Normal is 40. The parameters shifted in direction that explain the changes in pH represents the primary disturbance. The primary disturbance. The component that shifted in direction that explain the changes in the pH is the primary disorder. Suppose metabolic disorder, what will happen in here? pH will be low, bicarbonate will be low. In metabolic alkalosis, pH will be high, bicarbonate will be high. In respiratory acidosis, pH will be low, but PCO2 will be high. In respiratory alkalosis, pH will high, but PCO2 will be low. So the component is shifted in direction that explain the changes in the pH represents the primary disorder. Now evaluation for composition mechanism. Then determine the composition. Primary metabolic disturbance are quickly compensated via adjustment either via alveolar ventilation and carbon dioxide removal. The expected mechanism. Look at this chart. The expected compensation of the primary respiratory disorder is minimal for acute base disorder and reaches full compensation approximately 72 hours if PaCO2 or bicarbonate levels are within expected range. Then we need to remember these uh, appropriate compensatory PaCO2 and bicarbonate changes in acid base disorder. In metabolic acidosis, we need to remember the Winter's formula. Expected PaCO2 is 1.5 plus 1.5 into bicarbonate plus 8 plus minus 2. Metabolic alkalosis is 7 millimeter of mercury PaCO2 7 millimeter mercury increase in PaCO2 in per 10 milliequivalent increase in bicarbonate. In metabolic alkalosis, a 7 millimeter mercury of PaCO2 increase per 10 millimeter mercury increase in bicarbonate. So alkalosis, pH is high, so PaCO2 will be high and bicarbonate will be high. So 7 for 10. 7 for 10. Remember this. In respiratory acidosis, what will happen? In respiratory acidosis, so 4 millimeter equivalent increase, 4 millimeter equivalent increase of bicarbonate per 10 millimeter increase in PaCO2. So respiratory acidosis looks like reverse acidosis. What happens in acidosis? pH is low and it will take the reverse formula like 4 out of 10. So 4 increase in P 4 increase in bicarbonate, 4 millimeter increase in bicarbonate per 10 millimeter of PaCO2. And respiratory alkalosis 4 millimeter 4 milliequivalent decrease in bicarbonate per 10 milliequivalent per 10 milliequivalent per 10 millimeter of mercury P decrease in PaCO2. So what is the main clue in here? In primary metabolic disorder, higher than the expected PaCO2 indicates primary respiratory acidosis, and lower the expected PaCO2 indicates lower the expected PaCO2 indicates an additional respiratory alkalosis. So if we find to if we want to find an additional uh, problem, if we want to find an additional primary acid base disorder like mixed acid base disorder, what happens in primary metabolic disorder? In primary metabolic disorder, higher than expected PaCO2, higher than expected PaCO2 indicates an additional primary respiratory acidosis, and lower than expected PaCO2 indicates an additional respiratory alkalosis. In primary respiratory disorder, higher than expected bicarbonate indicates primary metabolic alkalosis, and lower than expected bicarbonate indicates an additional metabolic acidosis. I know that the words are getting into a complex zone. I know that, but these things are very important to remember. Now we need these box to see. So metabolic acidosis, the primary. The primary is metabolic acidosis. Metabolic acidosis means pH is low. In mixed, pH will be very low. And now uh, the second losing there is respiratory acidosis where PaCO2 will be higher. So in disorder, in primary metabolic disorder, if we match with these words, again, uh, in metabolic acidosis, what will happen? Think metabolic acidosis is primary disorder. In metabolic acidosis, pH will be low and uh, bicarbonate will be low. If we find an additional if we want to find an additional acid base disorder, what will happen in here? In metabolic acidosis and in respiratory acidosis, PCO2 will be high. So in primary metabolic disorder, higher than expected PaCO2, higher than expected CO2 indicates higher than expected PaCO2 indicates additional primary respiratory acidosis. And example is sepsis, like lactic acidosis with respiratory failure. And in here pH will be very low. And metabolic alkalosis. And if we think this like the third one, metabolic acidosis, where bicarbonate will be in metabolic acidosis, where bicarbonate will be low and pH is near normal, bicarbonate will be low and pH should be low, but in here pH is near normal. So if we find pH is very low or pH is near normal, think about another pathology. I have discussed this previously. So in primary metabolic disorder, lower than expected lower than expected PCO2 lower than expected PCO2 indicates there is additional respiratory alkalosis and salicylate toxicity is the cause. So metabolic acidosis and respiratory acidosis causes sepsis, metabolic acidosis and respiratory alkalosis, salicylate toxicity. Now, in primary disorder in primary respiratory disorder, higher than expected PCO2, higher, like metabolic alkalosis. Think about metabolic alkalosis and respiratory alkalosis. In metabolic alkalosis, what will happen? In metabolic alkalosis, bicarbonate will be high as it is primary. Bicarbonate will be high and pH will be very high. Bicarbonate is high, pH will be very high, and PaCO2 would be low. The causes are hyperemesis gravidarum and hyperventilation of the pregnancy. Hyperemesis gravidarum and hyperventilation of pregnancy. And metabolic alkalosis with respiratory acidosis. In primary respiratory disorder, if higher than expected, bicarbonate indicates additional metabolic alkalosis. In primary respiratory disorder, higher than expected bicarbonate indicates primary metabolic alkalosis, and lower than expected bicarbonate indicates additional metabolic acidosis. This one, metabolic alkalosis and respiratory acidosis. Alkalosis, bicarbonate will be high, and pH is near normal. So think about, there is another pathology. So PaCO2 in respiratory acidosis, it is reverse. So PaCO2 is high. So it is over diuresed heart failure. Metabolic alkalosis and respiratory acidosis, over diuresed heart failure and underlying COPD. And metabolic acidosis and alkalosis, bicarbonate, PaCO2 is normal and pH is near normal. It is diabetic ketoacidosis with severe vomiting. Diabetic ketoacidosis with severe vomiting. This is all about mixed primary acid base disorder. Hope you enjoyed.